I'm Dr. Christin Finn of Equisport Medicine, Integrative Veterinary Services, and this is my dog Spring. We're going to demonstrate to you and talk about passive range of motion techniques for improved mobility and pain relief. Passive range of motion techniques are an excellent way that you can help your dog, whether they're young or old, or have arthritis, or have recently had surgery. Passive range of motion techniques are an excellent benefit to your dog to help them move better, feel better, and live longer. You have to remember, though, to be gentle. Never force the movement past your dog's resistance. Passive range of motion should be a relaxing, wonderful experience for your dog. It is not the no pain, no gain of the 80s. So take a deep breath and get zen with your dog. It's worth mentioning that Spring is very fit, he's young, and he has excellent mobility. So you may not be able to get the same degree of mobility with your dog, but doing passive range of motion will definitely be extremely beneficial to them. So I like to start with the dog laying on their side. You should get comfortable, that's very important. I align perpendicular to their spine. That's the best way to be able to reach all the limbs. Take a deep breath. Start by stroking your dog to help them relax. Most dogs are not like Spring that are used to this and relax really easily. So just gently stroking, and you can see that he is relaxed. We're going to do the forelimb first. So there's three main joints of the forelimb that we're going to address today. The shoulder, the elbow, which we can see when we flex here, and the carpus, which is like their wrist. So we're going to begin with keeping our hands open and putting one hand on the front and one hand on the back to encourage straightness. Notice I don't grip or close my hands because we never want to grab or pull. People don't like to be pulled. So then you slide your hand down the paw and then push everything into flexions. So we have flexion of our three joints, the carpus, the elbow, and a little squeeze to get the flexion in the shoulder. And then you hold it there for about 10 seconds or whatever a nice deep breath takes. Then straighten it back out. Again, I straighten by pushing, not by pulling. Okay, friend, and your dog will probably be a little fussy and move around. Just keep breathing and keep your cool. So then we have our straight limb, and I'm holding at the carpus down low and opposing that with my other hand. We're going to pendulum fold forward, stretching through the shoulder and keeping the limb straight. If you can't go forward and the limb starts to bend, then you can't go as far. Just sit with it. Again, take a deep breath. Then we're going to pendulum back, flexing the shoulder and keeping the limb straight. Take a deep breath. Good boy, Spring. And then come back. We want to stay in the plane of the body, the normal alignment. We don't want to be lifting up, and we don't want to be torquing down to create undue strain or discomfort on the joints. And then you can just release the forelimb, and then we'll move on to the hind limbs. In the hind limb, we have three main joints we're going to talk about as well. There's the hip joint, the knee joint, or the stifle as we term it in dogs, and the hock joint. Go ahead and lay down, Spring. Good boy. So we're going to start as we did in the front with the legs straight. I'm pushing on the knee, and I'm opposing that push while I'm on the tarsus. And then we sit here and we have a nice breath. I slide down along the paw and bring everything up into flexion. I keep this metatarsal region, it's called, or we can call it foot or paw, parallel with the spine. So then we get good, ideal flexion of all three joints. Take a deep breath and then release all the joints into extension. And then I'm going to pendulum forward. Okay, Spring, good boy. There we go. So I'm going to pendulum forward. And that's a pretty excellent hip extension, or say hip flexion. That's, most dogs can't get that. And then we're going to pendulum back on pushing from the stifle. We're extending the hip, the stifle, and the tarsus. And then pendulum back. And so since he was a little fussy with the first one, go ahead, Spring. Oh, good boy. I'm going to repeat this one. Good boy. Stay. Just sitting with it for a minute, stroking his hind limb. Good boy. And then bringing it forward. Pendulating it forward in flexion of the hip while extending the other joints. Now he's a little bit abnormal in that he can sit up while I'm pushing that forward. He's just very flexible. And then end with just some rubbing. So you can do passive range of motion anytime with your dog. You can do it once a week, once a month. You can do the front limbs one day and the hind limbs the other day. It's really up to you. Just remember to smile and breathe and enjoy your dog. And of course, we would repeat the other side at this point. But I think Spring's had enough. Thank you so much.